According to the American Cancer Society, skin cancer is by far the most common type of cancer. Early detection is the key to getting the right treatment and a good outcome. We talked with Dr. John Kessler from Virginia Oncology Associates about how to spot potential melanoma and how to lower your risk factors.
Melanoma has a tendency to invade. Metabolically, a very active tumor. It grows quickly, it invades quickly, gains access to blood vessels and lymphatic channels, which allows it to spread to the rest of the body, to any organ in the body.
It says melanoma kills an estimated 9,700 people each year in the United States. How can people avoid that?
I think the main thing is to try to pick the disease up early if possible. And the way you do that is be aware of your body, look at your skin periodically, the areas you can't see, maybe a family member could look at. Ask your doctor about anything you're not sure about. Avoid sun exposure. Try to avoid sunburns. Most of the risk is during our childhood and adolescent years, and that carries forward. So families should take care of their children, make sure they use sunscreen, and if I don't mention it, use sunscreen regularly and every time they go out in the sun. Very few melanomas are related to a familial tendency, only about 10%. So just be aware, anything you're concerned about, show it to your doctor.
Moles, brown spots, and growths on the skin are very common with most people, but how can they tell the difference between them and skin cancer?
The best way is to use the ABCDE method, where you look at the spot you're concerned about. Is it asymmetrical? Are the borders regular or irregular? Is there color variation? Do you see red, blue, black, and other colors there together? Is it, the D is diameter, is it larger than 6 millimeters, which is about the size of a pencil eraser? And E, is it enlarging or evolving? By evolving, I mean, is there itching? Is there bleeding or other new changes associated with it?
I know there's exciting new treatments available. Can you tell us about some that you have at VOA?
Well, the mainstay for the treatment of melanoma remains surgery. A couple of things. The surgeons are very good at removing these lesions, and we now know that you don't have to take as much normal tissue around the melanoma as maybe we once thought. We can do sentinel lymph nodes where we look for spread to nodes without having to remove all of them. And that takes care of disease that is fairly localized. Once it's spread beyond the capability of surgery, it really comes down to your immune system taking care of it. And we have ways of stimulating the T cells, which are part of your immunity that attack cancer cells. We can actually stimulate that to become more active. And we can also, there's a new antibody out called anti-PD-1 antibody. It goes by the name of Keytruda, that makes the tumor cell more visible to the immune system through a protein called a checkpoint protein. It actually inhibits that, makes the tumor more visible, and we can stimulate T cells. So not only have you stimulated the immunity, you've made the tumor more visible, the likelihood is you're going to have a better outcome, better control of disease, and that is brand new.
Once again, early detection is the key. If anyone out there has a question about anything they're seeing on their skin, what should they do?
They should see their doctor, and if there's any doubt, the doctor will perform or refer for a biopsy.
Dr. Kessler is with Virginia Oncology Associates. They have board-certified physicians in 12 locations across Hampton Roads. To find the location nearest you, visit virginiacancer.com.